So, this morning, as we debate the issues arising from C. difficile, we do, as others say this morning, feel for the relatives and all the NHS staff who have been involved in this tragedy in Nine Wells. I believe this morning this debate is about the expectations of all of our constituents across Scotland, and not just in Nine Wells, and the desire to feel safe going into hospital. For example, I think two of the instances within my work as a constituency member of cases where complaints have reached me about the Queen Margaret Hospital. They are also, my constituents are also treated at Nine Wells Hospital. I have never been invited to a meeting at Tayside regarding the tragedy at Nine Wells. Over the period of a year, there were 244 cases in Fife up to June 2009. Of that number, I have been unable to determine how many cases were in the Queen Margaret Hospital and how many were in other Fife hospitals. My constituents have raised a range of concerns about the infection control and information sharing with relatives and patients. An example being that when families are told that the cause or contributory cause of death of their loved one is C. difficile, but not recorded on the death certificates. I did raise this issue with the Scottish Government and was given assurances that guidance would be issued on the matter. I can also point to at least one case in my files described by the patient who wrote to the Cabinet Secretary and to Jackie Bailey can be matched almost word for word with the experience of my constituent at the Queen Margaret Hospital in Dunfermline. General Registers of Scotland statistics show that the number of deaths in 2008 for which C. difficile was a cause or a contributory cause was 765 compared to 597 in 207, an increase of 28%. Improvements in later quarters of 2008 suggest that deaths could have been avoided if the SNP had acceded to Labour's demands earlier. The issue raised by Joe Fitzpatrick was about hospital staff wearing uniforms in Tesco's. In my opinion, I think this is a legitimate concern, and Marlon Glenn has just passed that information to me. And I do believe that in Fife, that's at least one of the issues that has been tackled by the Fife Health Board, and I do welcome tackling the issue of wearing scrubs. I read the I'm sorry, no, you have spoken. MSPs have had major concerns over the Vale of Leven tragedy, and then at the beginning of 2009, in the three hospitals mentioned by my colleagues, Orkney, Caithness and Elgin, in the first 5 months of 2009. I too read the NHS Quality Improvement Scotland report published in June this year that related to the three outbreaks. I think it's a damning indictment of the lack of action by the Scottish Government. I really don't think the QIS report went far enough, because on every occasion the QIS seemed to suggest that the communication stops at the board level. That's the whole thrust of our arguments this morning. It's about communications urgently to everyone across Scotland with appropriate and up-to-date information. Where is the action to follow on through the appropriate urgency of command and control? That's not apparent to us. The people of Scotland have a right to expect urgency. They have a right to feel safe. They have a right to expect that their loved one will come home from hospital. This is an issue of local surveillance matched with national action. Surveillance, the QIS report said, is a specialist area. Surveillance is basically information for action. The QIS report states, as an activity, local surveillance needs to be applied in a highly systematic, structured and well-managed fashion. This surveillance, in my opinion, is a vitally important part for infection control, requiring effective local reporting procedures for collection and feedback of real-time data to local ward and managerial staff, to the very top of the NHS and to politicians, as it happens, and not weeks later. This is the point, Presiding Officer, where Labour's demand for a single website should be agreed without any further delay. The website would be updated in real time, showing the performance at every hospital in Scotland and guidance provided to health boards on reporting outbreaks immediately. The current portal, buried away on the Scottish Government website, is totally inadequate, with information months out of date. Presiding Officer, it is not apparent to me that there is any reassurance from the QIS report or from anything that the Scottish Government has done. We continue to have complacency. Where is the indications of urgency, or indeed of any clear command and control of the C. difficile issue? What action has the SNP government taken on the QIS report? It is not so long ago that we learned through the work of my colleague Richard Simpson that Health Protection Scotland could not provide the figures broken down by individual hospital, the number of fatalities in which the infection was the primary or contributory factor in the death. A year later, this information still does not seem to be available or published on the Health Protection Scotland website. I tried last week to get information from the NHS Fife website about the Fife hospitals, and even that proved impossible, with first efforts showing that the NHS Fife reports and minutes of summer meetings were at that time not posted. Thankfully, there is a degree of progress this week. However, you do have to dig deep into these reports that are published on that website, and even then there is barely 3 lines devoted in a report on such a hugely important health concern for the people of Fife. This is not acceptable, and, Presiding Officer, the Scottish Government should show leadership and require of Health Protection Scotland that the data is provided in detail for each hospital by hospital. The Scottish Government should also require of the NHS Chief Executive that he takes actions on the points raised by NHS Quality Improvement Scotland. Targets are not enough, Cabinet Secretary. The public want and demand information on their local hospitals so that they can work in partnership with others in the health service. As others have said, 9 Wells incidents have also raised particular concerns around transparency and speed of intervention. Nicola Sturgeon was aware of the deaths for nearly 3 weeks before NHS Tayside made them public. It took around 2 weeks after the first positive case on the 14th of October for Health Protection Scotland to visit the hospital. The Healthcare Environment Inspectorate didn't arrive until its previously scheduled inspection date of the 11th of November, nearly a month later. As mentioned earlier, the QIS report into the visits highlighted the need for a fresh look, and all of the points that have been raised by both Marlon Glenn and by Nanette Milne are really vitally important. The Royal College of Nurses, in its briefing to MSPs for this debate, strenuously shared the concerns about the clarity and the complexity issues. They say that such an enormity of information is causing huge stress and anxiety amongst its membership. Finally, Presiding Officer, I believe that the Scottish Government's actions so far look like a job half done. Ministers are still over-reliant on self-assessment, which was shown to fail in the case of the Vale of Leven. We still don't have adequate information about the performance of individual hospitals, and the recent outbreak in Orkney indicated that many health boards are failing to properly implement guidance on infection control. That is why Labour is calling for a fully independent inspection regime. Thank you, Presiding Officer.
Right now.